Yeah, thanks for everybody for being here today. Good afternoon. I was going to say good morning, but I guess we've passed that threshold. My name is Priscilla Andrews. I am a multisyllabic title here at the center. I'm the Director of Clinical Services and Programs, which just means that I oversee our clinical offerings and also our wellness and educational programming as well. So thank you so much for being here with me today, talking about one of my favorite topics to talk about. As was mentioned before at least started recording, I've been doing treatments done now, probably for over a decade. And one of my areas of interest as I've spent my career here at the Cancer Wellness Center is around that transition from treatment to post-treatment and beyond. So I'm happy to have you guys join me here. Uh, oh, it says evening. It's only noon. Uh-oh. Um, just just to kind of orient you as far as what I'm planning to cover here today, I'm going to spend a little time up front talking about our nervous system and how we respond to stress and crisis. I think it's really helpful to have some context to some of the things that you may have been experiencing as you've moved through your diagnosis and treatment into post-treatment, or perhaps you're here because your loved one has been through diagnosis and treatment. That is a way we come hardwired to respond to things. I find often when I go through this part of the program, there's just a sense of relief for many people at understanding a little bit more why they've been responding the way that they have been. We'll also be talking about some common responses that people have when completing treatment. You'll notice that there's a lot of things that I'll say common, or maybe sometimes I'll say usually, or I might even use the word normal, but normal is a pretty wide range, right? So I might give some markers. It's not an exhaustive list of how you may have been experiencing things. That would still be a common response pattern after diagnosis and treatment, but just like to give some common things that people tend to encounter as they're transitioning into that post-treatment phase. And then I'll also give some tips around things that you can do to help cope and sort of improve your overall well-being as you are entering that recovery phase of a cancer diagnosis. I like to put in here to ask questions. I have the chat up, so I will try my best to be monitoring that. Lisa's also really good at saying, hey, there's something in the chat there for you. So, we are recording and you're welcome to come off mic. It would be in the recording, but if you put it in the chat, if you have a question or a comment, certainly welcome for you to put that in there. So let us start with some definitions. So when I first started here, I've been with the center since 2006. We would call everybody a survivor. And then people would say, well, I'm still in treatment. Am I a survivor? And we would say, yes, you're a survivor from the day you've been diagnosed. And what I quickly learned, or maybe what we kind of as an organization learned, is survivor is a complicated term. Not everybody identifies with survivor. If you're still going through something, if you're still experiencing the side effects of treatment, if you're still struggling with the long-term impact of a cancer diagnosis, it may not feel like survivor really applies to you, even if it is a term that gets sort of bandied about as soon as you receive a diagnosis. Often I will ask people when I'm doing this program, we couldn't get polls to work today, how they feel about the term survivor. And there's a few people that like the term and maybe even use it themselves. Majority of people either feel, meh, it's okay if somebody refers to me as a survivor. I don't use that term myself. And then there's typically a pretty good percentage of people that say, I don't like it. I don't like the term survivor because it implies I'm over and done with something, and it's still present for me. It's present for me physically, it's present for me emotionally, it's present for me mentally. And so, what exactly have I survived? Because it's still present. Um, so, a term that I do like a bit more, even though it includes the word survivor. So, I'm kind of talking out of both sides of my mouth here. I do like the term survivorship. Mainly, I like the term survivorship because I like the definition. Because I think that cancer has tendrils. I don't need to tell you that. And it shoots out these tendrils like Spider-Man that spread out and impact multiple areas of your life, not just your physical health. And survivorship really is a term that is meant to include and encompass holistically all of the issues that might come up around a cancer diagnosis. Maybe physical, psychosocial, so things related to your emotional well being, your relationships. Certainly, cancer can have an economic toll. You may have heard the term financial toxicity. That's sort of a new term being used to really just acknowledge the financial burden of a cancer diagnosis. And so survivorship is really intended to take all of those things into account. So if you hear me use the term survivorship today, that's really what I'm trying to refer to in that one word, is to encapsulate all of the ways that this medical diagnosis can come to bear on your life, on your family's life, and beyond. So I like to call expectations shooting all over yourself, right? We all have expectations of things. And one of the difficult things is sometimes we don't even know we had the expectation until the expectation hasn't been met. I used to do this post-treatment one-to-one program. And one of the things we would do in that program is spend a whole session talking about expectations. And I would ask people to write down what did they expect moving into post-treatment was going to be like, and then what did it end up being? And most people say, I don't really know what I expected, but this ain't it. I didn't expect to be feeling this way. I didn't expect to be having these emotions. I didn't expect these responses from people. So there's a lot of misconceptions out there that maybe you have for yourself, or maybe they've been communicated to you by others, right? And when I say misconception, I would say the idea that this is all you should be feeling, because some of these things may be a part of what you've been experiencing, right? Maybe it did feel like, oh my God, thank God that the treatment is done. Maybe you're feeling a little bit better than you did um, during your worst round of chemo. Maybe there's parts of you that still feel very much present as you're moving into post-treatment, and you feel a little less in need of the intensity of support that you need, and you're grateful for the fact that you got through the treatment, grateful for your healthcare team. But not necessarily, right? You might not feel like celebrating. Treatment is cumulative. I've had people who they start experiencing a side effect after chemo is done. It can be hard to feel like the person that you felt like before cancer. We have so many major life events that we experience where we would never expect the person to be the same on the other side, right? Parenthood being one of them. Now, parenthood is different than cancer, right? Parenthood is typically something that we do celebrate, but it is this major life experience that requires a lot of time and energy, that changes the fabric of your daily life. And we would never think that after somebody has a child, that their life and who they are is going to go back to who they were before. And yet, with a cancer diagnosis, that's exactly what we expect, even though a cancer diagnosis requires us to rearrange our life, completely change our routine, put things on hold, perhaps that we were planning to do or pursue, pushes against some of our belief systems and some of our ideas about how the world works, right? So there's lots of things that tell us, yeah, cancer goes on for long enough often that of course it is going to leave an impact on the people who've went through it. There's also this misnomer of like support, right? Maybe if you've been lucky, there were those people that um, organized the meal train and texted to see how you were and drove you to treatment. And for many people, what they experience is that kind of starts to dry up unless maybe they've got that friend or family member who either went through a cancer diagnosis themselves or had another close person go through a cancer diagnosis and has the sensitivity to recognize that ending treatment can sometimes feel like stepping off of a cliff into the unknown. And certainly, while gratitude is part of it, it's not all of it. And I don't know many people that are just grateful to have had cancer and had to go through everything that they needed to in order to treat it. Um, and just to acknowledge a couple people put in comments here about, survivor being the only way, maybe within the healthcare, somebody who's involved with the healthcare system, the only way they think of people who have or have had cancer, right? So we do use that term quite frequently. Somebody else said, being a multiple primary cancer patient who goes in and out of remission, I love using the term survivor for myself. It mentally motivates me, right? So it can be a positive moniker to use, uh, just creating space that there can be multiple ways to relate to that term. So I always liken, I said that finishing treatment can sometimes feel like falling off of a cliff. And I think of it as, it's like your oncology team, you are like the baby bird being pushed out of the nest and being told to fly. And that coming after a period of time of intense monitoring, of frequent interaction with your healthcare team, not just the oncologist, but the nurses, the administrative staff, the technicians, right? You've got this whole circle of care surrounding you that typically, when you're done with treatment, they say, bye, we'll see you in 3 months, we'll see you in 6 months. And all of that contact disappears in an instant, right? And can be very anxiety provoking, not only to have that support go away, but to feel a sense of loss around that when maybe you were looking forward to the end of treatment. It can be very anxiety provoking because treatment is a very active way of dealing with a diagnosis. And when you're done with treatment, there can be a sense of, what am I doing now? How will I know? What if it comes back? What's that ache or pain I have? And while you're in treatment, there can be that option. You're going in to get the blood work, you're seeing the oncologist, you're seeing your nurse to ask them those questions. Whereas now you're kind of floating without that and having to decide, does this rise to the occasion of putting a message in the portal or calling the office to find out what's going on? So there is a woman, her name was Jimmy Holland. She was a psychiatrist at Memorial Sloan Kettering. And she actually is really the person that spearheaded a recognition of the need for psychological, emotional support for cancer patients. Prior to her work at Memorial Sloan Kettering in the 70s, cancer was really viewed as a purely medical diagnosis, and little was really appreciated or understood about the emotional toll that cancer can have on people. And just to take a pit stop to say, research shows that anywhere from like 30 to about 60% of cancer patients have anxiety and depression as a result of the diagnosis. And I don't share that to be negative and be like, oh my God, right? I share it to say, if you are experiencing those symptoms, there's lots of other people who are as well. But coming back to Jimmy for a moment, she coined this phrase that when you're done with treatment, you're disease free, but not free of the disease, right? You may have gotten the news from your doctor that there's no evidence of disease, that you're stable. Some doctors will use the word cure. That's a little less frequent now, but you've gotten the message that the treatment worked and you're looking good. That's what is going on as far as the cancer cells in your body, the tumor that was there. It's a whole nother thing to be recovering from the reverberations in your life that were caused by cancer and all of the things that were made necessary by getting diagnosed. It's almost like cancer is like a pebble that gets thrown into a pond or skipped across water. And long after that stone, that pebble has descended into the water and is no longer seen anymore, there are still that ripple effect on top of the water, on top of the pond that we can see long after that pebble is gone. So that's why I think it's really meaningful to just take this moment to talk about how do we react in a crisis. And this is this is about any type of crisis. This is not specific to cancer. And I think we could all agree cancer is a crisis. It's a manageable crisis, but it's a crisis nonetheless. And for some of you, this might be the biggest crisis you've ever encountered in your life. And for other of you, maybe you've had other types of crises, medical or otherwise, and this is sort of almost ranked internally among those other crises, right? I had a client once had a very significant blood clotting disorder that kind of put her at a high risk of stroke at any time. That was a much bigger ongoing crisis for her than her cancer diagnosis. The cancer diagnosis was still a crisis to be managed, but to just acknowledge, like you may draw on other experiences as I'm talking about how we respond to a crisis that resonate with you as I'm describing this. So how do we react in a crisis? There's this guy, Hans Selye. He was an endocrinologist back in like the 1950s, 1960s, came up with this theory called the general adaptation syndrome that's pretty widely agreed upon as like a basic understanding of how we respond to extreme stressors, right? That research has been built on, but I think this gives a really nice foundational understanding of what is going on in our bodies. How is our nervous system, how is our brain and body wired to respond in a crisis? So one of the things that Selye discovered was we all have a certain general resistance to stress level, right? And we can think about people who have a very high resistance to stress. It just seems like things roll off of them. It's like water on the back of a duck. And then other people, I call them the people that have cancer of the hangnail. Everything is an emergency, right? For the purpose of today's, we're going to just say we are right in the middle of that bell curve. We're all in the sort of middle line of our stress resistance under normal circumstances. Okay, so what happens in the immediacy of a crisis? Well, the first thing that happens in the immediacy of the crisis is the crisis pushes against that stress resistance and actually lowers it. So, what does that mean? That means in the immediacy of crisis, we are going to be in an alarm phase and we are going to show our responses, our stress responses, right? Our stress responses can fall into four broad categories. The examples in these categories are just a smattering of examples. It's common to have signs of stress in more than one of these categories. It's also normal to have maybe some of these categories dialed up more for you than others, right? What is the loudest alarm bell that you hear? Maybe the loudest alarm bell for you has to do with the physical signs of stress. You notice your heart beating, you notice that tightness in your chest, you're breathing more shallowly, right? Maybe for other of you, the thing that stands out the most is cognitively, you can't even think straight. Your mind is blank, right? Or your mind is racing. I think of it as like a tuner, and we all these different things that could happen, all these things that could be signs of stress are little knobs, and we each have our own little profile of how they show up, when they show up, how intensely they show up, right? When you look at this and you're relating to this, these are signs that there is a gap between your resistance to stress and the pressure against your system, right? These are alarm bells. These are things that are telling you, uh-oh, my system has moved into a survival state because it is trying to deal with something that is a threat. Okay, so now here's the good thing. Our system is wired to help us deal with a crisis. So what happens? We get these hormones, adrenaline, cortisol, they come on board, and what they do is they don't just return us to our normal level of resistance to stress, they actually elevate it. So they put us into a state where we can really meet the demands of what's in front of us. Now, this seems like a great thing, right? Well, Priscilla, we should just stay there. Why can't we stay in this elevated state? Well, the thing is that our system is not made to stay in that state over a long term. It's really intended for that short burst to help us get to safety, right? You think about caveman days, there's a saber-toothed tiger, there's a bear, it's chasing after me. What do I need to do? I need to have my resources online so that I can get somewhere to safety. And then I'm going to get to safety. I'm going to realize I'm safe again. And that process is going to turn off, and I'm going to go back into homeostasis. I'm going to go back to my like level, my internal level, right? Cancer doesn't work that way, right? You hear the words, I have cancer, you go through treatment planning, you maybe have surgery or chemo, you have chemo or surgery, you have radiation, right? This goes on. You have blood work, maybe you have another scan, maybe you've got to have a treatment change, maybe your treatment gets extended, right? It's not this time, doesn't happen in this guardrail time period. It can go on for months, depending on your treatment. It can even go on for almost a couple years, right? So we go through this resistance phase, but at a certain point, all of us are going to reach a place of exhaustion. Our resources are just going to be tapped out. This is not me. This is not you. This is just how we come wired. And we are going to move into an exhaustion phase. And so what's going to happen in the exhaustion phase? What you can see on this curve is our resistance to stress is going to be lower than it typically is before we went through that experience. What does that translate into? People coming and sitting in my office and saying, Priscilla, I don't know what's going on with me. I feel like I'm going crazy. I cry at the drop of the hat. I have less patience for my kids. I'm irritable with my partner. I'm having difficulty focusing at work. My sleep is disrupted. Every little thing seems to bother me, right? Very distressing to go through that, right? I always like to say I want to normalize without minimizing, right? Just because this is normal doesn't mean it's not still something worth trying to cope with and do something to help you heal from. It is more to point out that there is nothing wrong with you if you are finding that the things that didn't push against you and cause signs of stress are now pushing against you because you have just expended a lot of yourself to get through something that happened over a prolonged period of time that was challenging, and your system was working hard to help you meet that challenge. So this translates to lots of different experiences that you may be feeling now, right? You might be feeling any one of these or combination of these. And you can see here at the bottom, right? You could feel relieved, you could feel grateful, and at the very same time, you could be pissed off, you could be sad, you could feel lonely, right? These things don't have to be mutually exclusive. One of the gifts that Pixar gave us was the movie Inside Out. I don't know a single mental health professional that doesn't love that. I see some smiling faces because if you haven't seen it, what happens is at the beginning of the movie, the little girl has these distinct balls that encompass emotions. And what you learn at the end is those balls are multicolored, right? That joy coexists with sadness, right? That these things go together, which can be very confusing, right? It's easier if we can just be one thing. I think bittersweet is an experience that we have. It's a word we have for a multifaceted emotional experience, right? What does bittersweet mean? It's kind of sad. There's some longing involved, but the sweet part is the longing is because we're thinking about something that's joyful. We're experiencing something that's joyful, right? Those two things coincide. I'd also like to say something about numb. Sometimes numb gets confused as I'm not feeling anything. Numb is a feeling, right? Have you ever heard the idea of like not doing something is doing something, inaction is action, right? If somebody is numb in a situation where it would be normal to have some sort of emotional response, what that tells me is that their system has downshifted to keep them safe because their circuit breaker has popped. And if they were being flooded with everything that was going on, they couldn't do what they needed to do to get through their day. So you may experience a flood of emotions. Maybe you're feeling numb. And we numb isn't necessarily bad, right? Maybe some of you felt numb when you were first diagnosed. And that was helpful. You needed that. Like you needed to put your feelings aside, if you will, so you could focus on what you needed to do to figure out your treatment, your treatment team, get organized, right? This is a functional thing. Our system is wired to do this. It's just we want to be able to move in and out of that. We want to be able to move in and out of any of these emotions flexibly. And the challenge is when we get into one of these emotional patterns and we just don't know how to get out, right? Numb can be great if it's helping us put aside our feelings and really focus in on what we have to do. Numb is not so great if you're with your friends or your family or your kids or your grandkids and you feel nothing when you're with them. Right? That's when we want to do something to say, oh, okay, what can I do to take care of myself? Because I'm not able to flex and move into a state of savoring the experience that I typically enjoy. Um, Somebody asked, are there depression side effects after receiving general anesthesia and pain meds post-surgery? Oof. Um, I don't think I'm as a mental health professional, I would hesitate to answer that question. I could certainly wax poetic about just the shock to one's system of going through surgery and just being in the healthcare system and waking up in a hospital room and all of the different cues of danger that we experience when we're in a setting like that that can overload the system and cause it to feel what we call depressed. um, I would defer to my medical professional colleagues, and I think that's a great question to ask your oncologist if it's something that you're curious about. And I will say this later, but I'll say it now, which is there is never a, a bad time to ask your doctor questions if it's going to help you understand your experience and if they're the ones that are best positioned to answer that question. So would really encourage the person that shared that question, next time you see your oncologist, next time you see your surgeon, ask. And then you can come back the next time that I do this and you can stay on until this point in the presentation and you can let me know what you found out. or you can email me. Somebody just asked about repeating numbness. Okay. Numb is a state, our nerve is a survival state. It is a sign that our system has moved into a survival state. We have two primary survival states: mobilization, which typically gets referred to as fight or flight, and immobilization, which is, I think, only in the last couple of decades really becoming better understood. That is like, think about the like turtle that pulls its arms. Do they have arms and legs? Its legs and head into its shell, right? Because the signal it's gotten is, I'm not going to get out of this. And the safest thing for me to do is go inside. And we have that mechanism as well. Some of you may actually relate more to that than to the highly energetic state of being anxious or angry, agitated. That may not be what your system learned was the best thing to do in danger, right? Your system may have learned, you know what, the best thing for me to do is get real small and quiet and tone it down and try to get through this. And I should say that curve I gave, that is a generalization, right? Mainly because a lot of people are really feeling the exhaustion phase when they get to that post-treatment phase. But you may have experienced multiple waves. A lot of people will say to me, I don't know, I was freaked out when I heard the words cancer, and then I went to the doctors. I went for a second opinion. I figured out my treatment plan. I filled out my paperwork to take a leave. I kept working. I did the thing, right? And then halfway through treatment, I crashed, or, so it's not a one-to-one, right? If you found that you were like, Priscilla, I got to like post-surgery and I crashed, and I really relate to that exhaustion. And I just feel like I keep riding the wave. I'm like a surfer on 100-foot wave over and over again, right? I would say, yep, your nervous system is just like a boat in the middle of an ocean during a typhoon, trying to figure its way through that and having this undulation of how it was coping. Um, okay. So, I said earlier, this idea of, you go through something like a cancer diagnosis. Forget about calling it cancer. You go through something that requires your attention, that absorbs your attention, that intrudes in your mind, that impacts your physical well-being, that impacts what you are and aren't able to do, that requires you to do things differently, that requires you to reorganize your life, right? Didn't say cancer in there, just said some of the things that happen because of as a consequence. If you step back and you think, like, how could we not think that at least temporarily it is going to change you? It's going to change your perspective. It's going to change where you want to put your energy. It's going to change what energy you have to give. It's going to push against some of your belief systems, right? I always thought if I exercised and I ate healthy, then I would be able to avoid things like cancer. Now I have cancer. So what does that mean? Right? Reorganizing your belief system. Years ago, somebody that was in this said, "Oh, I saw this great cartoon that I always thought speaks to this, like, this sense of when we're sitting across from somebody and they're like, you're not the same, you're different, right?" And a lot of times sometimes the you've changed is positive, but sometimes it's neutral to negative, right? The person in front of you maybe expects you to arrive just as you did 6 months ago, 9 months ago, a year ago, 18 months ago. And you're like, I've been through something here. So here's my first tip. Be patient with yourself and with others. Now, if I could say those words and make everybody patient if I had a little bottle that I could sell and give to everybody to increase their level of patience. I will promise you, I love my job. I love the Cancer Wellness Center. I would be working it on Shark Tank and selling that elixir to all parents of a newborn child and toddlers and grade school and high school and college age, right? Like patience is something that is easy to preach. It is easy for me to say, be patient. Um, I find saying be patient is sort of similar to somebody saying relax. Um, it causes the counter effect in hearing those words, right? So it really is just thinking about it as being something to cultivate, right? It's something that you're working on and sometimes having an easier time and feeling more in touch with than others. So what are some things that you can do to help increase your patience level, right? One is taking each day as it comes. I know it's a little bit of a little trite, we hear that all the time. Being present, right? That concept from mindfulness, being present in the moment that you're in. Um, However, it is with good reason that mindfulness practices in a mindfulness frame is so beneficial and has been found with research so beneficial for people with a cancer diagnosis, because you are going to have times that are good, you're going to have times that are bad, you're going to have days that start out good and then you hit 3 o'clock and you hit that wall, right? The wall that makes you leave your shopping cart stock still in the grocery store and go to your car because you just can't. So just recognizing that. And I would also say, noticing, is there a pattern in that, right? Is there a pattern so that I notice I have a lot more energy in the morning and that bottoms out in the afternoon? So can I front load doing things that are meaningful and nourishing to me when I have the energy to do them? Or if I'm going to have that dinner at night with my family or with my friends that I really want to see, or that book club, or getting together to watch the game with some of my friends, do I take it easier earlier in the day because I know the evening tends to be a little bit more challenging for me? Alongside of that is, doing things at your own pace, right? The pace that you're at now may not and is unlikely to be at the pace that you were before you went through all of this. I typically recommend, what we often will do is we'll search back in time and we'll think about the things we were doing, the ways we could multitask, the energy that we had before we ever had cancer, before we went through treatment, maybe even before we had symptoms that led to the diagnosis. Because some people, right, you've had symptoms and the cancer answered a question. Some of you just got punched in the face and you would have not known anything was wrong until the mammogram or the lab test or whatever. And then you felt awful after they started giving you treatment, right? But we've got that, like, our best day becomes, that's the thing we're comparing ourselves to. It's even, it's off, it's right. It's not even on the screen. It's off the screen. What I recommend is we want to turn that point of comparison on its head. And what I want to encourage everybody to do is take your worst day, the day you couldn't get out of bed, the day you took a shower and needed a nap, the day you couldn't leave the house because you couldn't leave the bathroom, right? The day your neuropathy was so bad that you could barely stand up, right? That's your point of comparison now. Because if you do that, then it is going to allow you to reveal to yourself the incremental progress that you may have been making all along. Because otherwise, what you're doing is you're craning your neck constantly and looking at the top of a mountain that you're trying to get to, which makes it really, really hard to see the progress that you've made already and can be very demoralizing, right? Because, like, realistically, right, there might be changes that are more permanent based on what your treatment required of you, right? There may be things that you're told to avoid. There may be things you're not able to do in the same way because of the impact of surgeries. right? So how can we rebuild from when we were ground level versus trying to reach onto the top of the Empire State Building and put an antenna from ground level? Um, and so I think you can hear me leading into this, giving yourself permission to heal. This is going to take time. One metric that I heard that always stuck with me is for every round of chemo, for every chemo treatment, expect a month of healing time. So if you had 12 chemo treatments, that's a year. Now, that doesn't also factor in if you had surgery, if you had radiation, right? If you had immunotherapy. This is a very broad stroke equation that I'm providing here that does not address the variety of combinations of treatment that people here today may have had. What it does communicate is, right, this is going to take a little while. And it doesn't mean that there's not progress along the way. It just is like going back to that notion of expectations, of pausing and thinking, do I have realistic expectations for myself? As well as do people around me have realistic expectations, right? Sometimes we're our own worst critic. And our friends and family grant us lots of grace and say, take it easy. And, of course you're still healing. And what can I do to help? And hey, just wanted to see how you're doing today. And we're the ones generating it. However, most people typically have one person, at least one person in their life that just directly or indirectly lets them know that they should be doing better than they are, or the expectation is. And sometimes it's very direct. Oh my God, you're done with treatment. You must be so happy and excited and elated. And it's like, well, yeah, I am, but I'm all these other things. I don't feel like I'm done with treatment because I'm still dealing with fatigue, or my GI tract is still healing from that, right? You think about radiation. Radiation, the full effect of radiation doesn't happen until like a week after you started radiation. So think about that, right? Um, so you're going to get those mixed responses. I think there's also the like implicit expectation, right? Oh, mom, you're done with treatment. Great. Ted and I have been waiting to go away for the weekend with the kids. Can you and dad take the kids for the weekend? What's the expectation there? That you're going to feel up to it, that you're going to have the energy for it, that you're going to want to do it, that you're going to have the emotional patience and bandwidth to do that, right? Lots implied in that are not stated in words, but are implied based on the ask. And finally, recognizing that grief is a normal human response to loss of any kind. And we often think of grief specifically in the frame of losing a person, but that's not the only time we experience grief, right? There's lots of forms of grief. Grief over loss of lost time, grief over lost ability, even if it's temporary, grief over loss of certainty, grief over loss of a sense of being a healthy person, right? Grief over loss of a body part, relationship because somebody didn't show up the way you needed them to, and that relationship feels lost. Sexual health, maybe you and your partner aren't connecting in the same way, or you're not interested, right? In the same way, right? Those are all losses. And if you can relate to that, we have a program coming up at the end of the month with Stephanie Aaron, our clinical manager. I have a QR code here. If you have not used those before, you can open your camera up, and it will give you a link to the registration. Well, not the registration page, but the description of it. If you can really relate to this and would like a more robust discussion around coping with loss when it's not about death, but is about all these other ways we experience loss related to a cancer diagnosis. Before I move on to tip number 2, I'll pause here just to see if there's any questions people or comments people wanted to throw up in the chat. So I'm going to open the door to that. I'm going to move to the next slide, but please feel free to put something in the chat that you'd either like to share with the group or a question that you'd like me to address about what I've already covered. So what's another thing that we can do? Somebody just asked about the QR code. So the QR code is on here. It's that weird black and white squiggly thing in the lower left corner. So if you have your phone and you're not on it, you can pull up here's my phone. You can pull up your camera. If you pull up your camera, what will happen is it will give you a little tiny link at the bottom that you can hit that will go to the website. But you're going to get my slides too. So the QR codes will also be on the slides as well. I figured that was easier than putting this lengthy gobbledygook URL. Okay, find ways to be empowered, right? How do we take back our sense of knowing this is what I can do, right? So what are some strategies for that? One thing is to be informed. What research shows is people who have information that they need are better able to make decisions, more engaged with their healthcare, and also have lower rates of anxiety, right? And you want the right fit there, right? If you are the person who is doom scrolling on the internet, if you are on all of the Facebook groups with all the people, with all the things, with the person that's got the worst case scenario, right? And your family, your friends are saying, Joan, put it down, get off of your phone, right? Bob, why are you on the computer again? And you never feel satiated, okay? That is a sign that the information seeking is likely a behavior related to stress. It is a sign of your stress, right? If you can go and get the information you need and put the phone down, turn the computer off, right? That's a good sign that you are doing the adequate amount of information gathering for your well-being, for what you need. So one of the best ways to do that is to talk to your doctor, right? Your doctor, you can go all over the place and get all kinds of information, but that information is not going to take in your unique profile, your medical history, your family history, the way you responded to treatment, what your goals are, what your definition of quality of life is, right? Your healthcare team is going to be best positioned to answer questions related to your care. And if you are finding information on the internet, that's a great thing to come back to your doctor when you see them again and ask them, I saw this, does this apply to me? I noticed this treatment plan. Why was I given the treatment I was given instead of this? Right? We're very creative as humans, and so we make up stories to fill in the blank. We all do that all the time. We're always trying to make sense of our world. And so we can fill in the blanks. And really what we want to do is we want to lean on our healthcare team's expertise to fill in those blanks for us. If you find yourself filling in blanks, that means it's a good thing to talk to your doctor about. So one thing you can do is a survivorship plan. Now, some healthcare systems, some oncology teams, they will automatically do this, right? What is a survivorship care plan? It basically is, where have I been? Where am I at now? And what needs to come next, right? Here's my record of all my treatments. A lot of stuff is in electronic medical records, right? But there's the piece of like, do I understand it? Do I understand why they chose that particular treatment plan? Do I understand what my pathology report said or what my scan said, right? Or if I don't, do I at least know where that information is if I ever need it or wanted it? Do I know what my next steps are? When am I going to be seeing the medical oncologist? When am I going to be seeing the surgeon, right? I think another thing to talk to your doctor about is, what do you want me to come to you for versus going back to my regular GP, my family medicine, my internal medicine, my gynecologist, right? During cancer treatment, it's typical for like your medical oncologist to kind of play quarterback, and they're the one that you're going to with everything. And at a certain point, that is going to start to transition, that you'll be going back to your general physicians, that you might be sent more to like a different specialist and not the oncologist. So that can be really helpful to talk about. I think something else that can be helpful for some people, you need to know yourself, is to talk about prognosis, right? Is there a sense of what the likelihood of recurrence is for me? And how would we know and what would we do about it? Now, some of you are probably white knuckling as I'm saying this, and you've got your finger over the exit button because what the heck is Priscilla talking about? However, bear with me. Sometimes the fear of the unknown is worse than knowing. And sometimes having these conversations opens the door for the doctor to share information that can help you discern down the line whether or not some symptoms, some ache, some pain is likely to be related to your cancer or not. Because right now y'all have cancer glasses on. And so any ache, any pain, any sensation that is not common, it's going to be normal. You're going to look through that cancer lens and you're going to be like, "Oh my God, is this a sign?" So having this conversation, what are you going to be monitoring for? Is there something like I should, like how long, right? I typically, like, if you don't have a symptom for more than a week, it's like, okay, that's transient, right? But have that conversation with your doctor. It doesn't mean that you don't go to your doctor or your oncologist with any of your concerns. It at least maybe gives you some information so that you can talk yourself off of a ledge, and perhaps be better equipped to decide what your next step could or should be. The other thing too is thinking about how you communicate with your healthcare team. And I don't mean like, oh, what medium do I use? Am I talking on the phone? Am I writing a message? I'm talking about like when you're in dialogue with your healthcare team, what are you doing to make the most of that? And thinking about this acronym of take part, right? And what I find is most people do P, A, and T. They prepare to talk to their healthcare team. They write down questions. I will tell you, I always recommend write them down, print them out, bring a copy for you, give a copy to your doctor. This is my agenda for this meeting. Sometimes the doctor is not going to be able to answer all of those questions, and they may say, I'll send my nurse in, I'll send my PA in, right? It at least lets them know this is what I want to have addressed today because this is what's been on my mind. The A, right? You want to ask the questions. If you're going to generate the questions and think through what do I need out of this appointment, you execute on that. People are typically pretty good at following up on what the doctor's recommending they do. What is often novel for people to hear is this idea of repeating back to your healthcare team what you heard them say. Okay, so what I understand is you want me, I'm really on average going to be meeting with somebody every 6 months, but what you recommend is that I schedule to meet with you in 3 months, and then I schedule to meet with the surgeon 3 months after that, so that I am staggering and meeting with somebody every quarter. Is that correct? Okay, what I heard you say is that what you're really going to be looking at is a combination of my blood work and a scan, but I probably wouldn't have a scan unless something showed up on my blood work. Is that correct? It allows the doctor to clarify if there's been a misunderstanding, and it also allows them to yes and you. In hearing back what you understood, it creates space for them to recognize maybe something important that they left off or something that they could provide you to make things even more clear than they already are for you. Another strategy for empowerment, twofold, okay? It's about mind body, right? The mind body piece is about relaxation practices, mind body part about physical activity, right? Why relaxation practices? Why doing something to manage stress? I kind of talked about some of this earlier on, right? Healing occurs when we are in a state of homeostasis. Homeostasis means that around us, our nervous system is sensing that things are more safe than dangerous. And we can think about danger as like that bear chasing us, but there's all kinds of other dangers, right? Hearing that you have cancer, running late for a meeting, being unclear about the information that your doctor gave you, right? These are sort of modern day dangers. And if those dangers outweigh our cues of safety, we're going to go into a survival state, which is going to throw us out of homeostasis. And it's going to put us in that mobilized state, or it's going to cause us to downshift into that immobilized turtle state, right? I'm in my cave. And so one of the challenges, it's not a challenge, it's an opportunity, okay? 20% of our nerves go from our brain to our body. 80% of our nerves go from our body to our brain. So think about the balance of information that is going up to our brain to tell us, is she safe or not? Is he safe or not? Is he okay or not? Is she okay or not? And when we're in that stress response, when we're kicked into a survival response, it can sometimes cause this feedback, right? Our body moves into a state of tension, our heart rate accelerates, our breath becomes more shallow, right? Our muscles tense. And so it sends a message up to our brain, and our brain says, well, Priscilla must be in a dangerous situation, so keep it going. And what a relaxation practice does is it takes advantage of that loop and it slows it down. Because if you are being chased by a bear, you are not going to pause to do deep breathing. If you are being chased by a bear, you're not going to do yoga, you're not going to journal, right? You're not going to do a meditation because you're going to be like, how the heck do I get away from this bear, right? So it allows our body and our mind to sync up to let us return to that state of equanimity, that state of homeostasis that is really going to allow our body to heal. And thinking back to that curve when I was talking about the general adaptation syndrome and the way we respond to stress, right? The good news is we can heal from being in exhaustion. And when we do relaxation practices, it allows us not only to return to our pre-existing stress resistance level, it can actually elevate it so that we have more bubble wrap around us, if you will, to weather storms that may come our way. Lots of different ways that we can get there, right? Mind body approaches, creative outlets, social connection, right? These are all things that can help our body regroup after we've been through extreme stress or even day-to-day stress. I mean, I think one of the other things is you might look at this and think like, well, these are some things that I may have been doing beforehand. And one of the challenges with a cancer diagnosis is between the demands of treatment and how you're feeling because of treatment. Sometimes things that you would normally do to manage stress go on the back burner. So this is a great opportunity to think about, what did I do to just help me feel good and enjoy life and before any of this happened, and have I been doing those things lately, or did I press pause? And if I did, are there ones that I could think about bringing back now? So the other piece of this is physical activity. So lots of benefits of physical activity. And I'm not talking about going to, what's the not core power, the CrossFit. I'm not talking about CrossFit. I'm not talking about flipping a giant tire over and over again, right? I'm talking about physical activity that raises your heart rate for 30 minutes, 5 times a week. That's walking for a half an hour, 5 times a week. Okay. Improved quality of life, reduced cancer-related fatigue, reduced distress, including symptoms of depression and anxiety, helps with quality of sleep. Lots of wonderful things to help your body heal, but also you can see that mental well-being piece that comes into play with physical activity. Now, I want to acknowledge starting new habits is hard. So wanted to just say technology can be your friend. If you have talked about wanting to make a change and have had a hard time implementing a habit, right? There's a wide range. I think it's like goes from like 22 days to like 164 days or 264 days of how long it takes for a new behavior to become a habit, but on average, it's about 2 months, right? Now, when we're trying to do a new behavior, how do we do that? Well, how do you eat an elephant? One bite at a time, right? So if you're trying to do something new, maybe you're trying to get into a physical activity groove and it's been challenging. There's this app, it's free. I think there might be like a paid version, but you can access this for free. It's on um, iPhones, it's on Android, um, and you can create a way to track habits to help you be accountable, to help give you some like a feedback loop of like tracking your progress. This app was recently recommended to me by some researchers at a training I attended at the University of Colorado. So if you're looking to implement some new habits, this could be a helpful tool if an app would be helpful for you. Um, somebody asked a question, just want to acknowledge that I'm going to finish this section and then pause to address the question. Okay. Now, if you're trying to start a habit and you'd like a little help and you want to try something new, you want to do it in community, right? It's just helpful to have somebody kind of lead the way a little bit. We've got lots of different offerings at the Cancer Wellness Center. Most of our offerings are, if not virtual, hybrid. So there's opportunities at times to be in person. There's typically always the ability to be online. You don't even have to leave the comfort of your home. Lots of different options, different times. We've got something every day of the week, Monday through Friday. We also have support groups, human connection, right? We are hardwired to need people. It's like Barbara Streisand said, right? She say, people who need people. So, if you're finding that the support you get from your family and friends is great, but I feel like I'm explaining myself. I know they're trying to be understanding, but I don't think they quite get it. Uh, a support group can be a great opportunity to talk to other people who've went through something similar. And you'll see here another QR code if you want to access our calendar of classes. Most of our weekly or bi-weekly classes, by and large, they are on Zoom, and you can come to our website moments before the class starts and access the Zoom link. You don't even have to register ahead of time. We do ask people to register ahead of time for if they're going to come in person, mainly in case something comes up and the instructor has to cancel. It doesn't happen very often, but in the event that it happened, we always hate when people make the trip here, only to find out like, oh, the class isn't happening because, the instructor is sick, for instance. So I'll leave this up here. Somebody asked, so what do I do? I'm got no detectable cancer cells. I'm on maintenance meds. But there's no finite period for treatment, right? So there's this open-endedness. I'm on maintenance meds. Maybe it's certainly with blood cancers. I ran the multiple myeloma group for many years, where uh, there can be with some cancers a sense of it's not if, it's when there's a relapse. I think that is where thinking about what type of ongoing support you need can be a good place to start. I think there is a big transition between thinking about cancer as episodic, meaning I had this thing that happened, and then there's going to be a beginning, middle, and end. And then I'm going to start driving away from it. And I'm going to be able at some point have it somewhere in my rear view mirror, right? That's one thing to cope with. It's another thing to cope with when cancer needs to be treated more like a chronic illness, where maybe I'm not always in treatment, but I'm going to have these sort of flare-ups and I'm going to move in and out of more intense periods of needing the cancer to be managed. That's when I think something like a support group can be beneficial, whether that be here at the center, or if we don't have a group specific to your type of cancer, finding other people with the same type of cancer as you, whether that be a group or turning to an organization like Immerman Angels that can do more individual peer support, I think can be really meaningful. I don't think it's a one answer thing, as with many things in life. I think what I would just want to end on is just acknowledging like that is its own beast, right? That's its own beast to tame and figure out, how am I going to live beside this when I can't, I can feel it in the backpack moving around, right? Metaphorically speaking. And I think I will also say my email address is going to be at the end of this. So, if it feels like I didn't fully answer a question, or you've got more nuanced experience that I'm not speaking to, you're always welcome to reach out to me afterwards if I didn't fully answer a question, or you want to talk it through more. Okay. So, strategy for empowerment. You want to try to find what's in your control, right? There's this notion of locus of control, right? Locus of control basically means, do we feel like we're the ones in control, or do we feel like we are being moved around by external forces like a brittle leaf in the wind, right? And there's lots of things in cancer that are outside of one's control. You didn't choose to get cancer. Um, Maybe you had some choice with treatment, but sometimes the choice is sort of a false treatment. Either I do the treatment or not. You might not have had choice when it came to when your treatment was, how long you were on treatment, right? Like these are things that that sort of shift that locus of control outside of you. And yet, there are things that are still in your control, right? One thing that is on everybody's control is being here today, right? You chose to register, you chose to come, you chose to stay here. Thank you very much. Um, so, right, like, and thinking about what is it that I still have volition over and I have choice over and I can act upon. Now, what is in your control? Now, I like to throw this up here because sometimes that can be an overwhelming thing, especially when it comes to health behaviors. Um, you know, it was the keto diet, it was asparagus, it was don't drink coffee, it was drink coffee, don't drink wine, right? Everything in moderation. Don't eat sugar, right? Like you could probably search, especially with AI, okay? You could probably get whatever answer you want out of it, which can be very confusing. Um, I will just pit stop and say, really important to turn to reliable sources of information. And while things are getting better, AI is not perfect. So if you're somebody who's used Dr. Google, Gemini, Copilot, OpenAI, Claude, one of these platforms, um, even the medical ones, right? They're getting better. There's some platforms that are medical. You want to talk to your doctor. You want to talk to a licensed nutritionist, dietitian. You want to get information if you are making lifestyle behaviors that are really relevant for you and are going to put you in the best position to care for your health needs. So that's my little plug about reliable information. So what is in your control? Well, it's different for different people. Here are some ideas. Set a daily schedule. If you were working before and now you're not, either temporarily or permanently before because of the cancer. If you are recovering from cancer and the treatment threw your whole routine off and you're not quite ready to enter back into those activities you did before. And your sleep schedule is off, and maybe you're not getting dressed when you get up in the day, and you used to be an evening shower and now you're too tired, or you used to be a morning shower and you get up and you're like, what's the point? I'm not going anywhere, right? These subtle things can have a huge impact. And so setting a schedule, I'm not talking about filling your day with activities. I literally mean like I am going to get up at the same time of day every day. I'm going to set an alarm. I'm going to get dressed when I wake up. I'm going to be more routine in when I shower, right? I'm going to eat at a particular time. I'm going to take a 5-minute relaxation break at noon, right? Having a schedule can be really helpful at just sort of grounding yourself after what can feel very chaotic when you have cancer. Problem solving. Sometimes we have stressors in our life we can do something about, and we can't always, we sometimes exhaust what we can do about the cancer. Um, and it can actually be helpful for us to address other stressors to lower our overall stress level so that the stress related to the cancer experience becomes more manageable, right? Thinking about, um, I mean, this is just like thinking about problem solving can be something like as simple as um, I hate my commute. I find it really stressful to be in traffic, right? Problem solving might be I'm not going to take the highway. I'm going to leave extra time so I can take side streets because I get less irritated. I'm going to start listening to books on tape when I'm in the car, right? This is the type of thing, simple things that we can maybe do to make our life easier, even if it's not related to the cancer. Um, Alongside of that is assessing is the balance between where I'm putting my energy and what is most important to me, do those have a relationship to one another, or do I find that I'm frequently giving my energy to things I have to do or things I feel obligated to do, and there's very little energy left over to the things that are important to me, that are important for self-care, that are related to spending time with family and friends, that are about doing things that I think that I view as either enjoyable or important to be engaged in the world. And if that feels uneven, that's where you could sort of go back to the problem solving and say, like, what can I do so I have more energy to give more time to the things that are important to me, right? Like I had a woman years ago, and she had an issue with like how much energy she had, and she couldn't totally address that. It was just a artifact of the treatment. But what she could do is when somebody asked her if they could help, she said, yeah, can you take my clothes to the laundry? She had started having her laundry done. Okay, well, what did that do for her? Well, what that did for her is it took something off of her plate that took time and energy, and it allowed her to give more energy and time to spending with her son, right? Small thing, friend wanted to help, kept asking to help. Meaningful change for her because then she got to feel more present with her son, felt good about her role as a mom, felt more grounded. Um, Following up with your doctors, talking to them, asking them questions when you're there, staying engaged with your care. I always feel like I want to put a plug in for that. A big one, I know it's on the bottom, but you'll see why in a second. A big one that people choose to do is to make healthy lifestyle changes, right? Changing what they're taking in, eating healthier, reducing alcohol, moving towards a smoke-free, nicotine lifestyle, more physical activity, working to improve sleep, right? There's lots of different routes we could go. There's a couple routes coming up here if you're wanting some support. So we run a program called Food and Fitness for Wellness. You can see my colleagues, Lori and Gabby, who run that program. Lori is a nutritionist, Gabby is a psychologist. And it really is, even though it says food and fitness, It really is about overall healthy lifestyle changes. And you kind of get that team approach of somebody who has a deep knowledge around food and nutrition and nourishing your body, that information piece paired with somebody who is expert in the psychology of making behavior change, of coping strategies, etc. So we'll have a new group starting in August. I will acknowledge we may be looking at changing the name. So if this is something of interest to you, you can be on the lookout for something coming up in our calendar. Probably might make its way in there in July. We typically have an info session about the group before you even join to see like, hey, is this what I want? So if you see something about like a healthy lifestyle group or a healthy lifestyle program, it's probably referring to this. So stay tuned on that. I did include a QR code that goes to our nutrition page. If healthy lifestyle, oftentimes people do want to make changes to their diet and what they're eating. There's a whole bunch of other programs we offer in addition to that component being represented in food and fitness. Alongside of that, you can see Gabby up here again, along with our other psychologist, Megan McMahon. This summer, we will be doing a new Strategies for Ongoing Sleep Problems group. It's a 4-session program that is intended to help people who are having difficulty with sleep longer term. So that means 3 weeks or more of disrupted sleep, difficulty with sleep, and they will be working with people, both group as a whole, but also working people in smaller groups and individually to help implement specific strategies that research has found are a non-medication related way to improve sleep quality. So if sleep has become problematic for you and it's not related to something like sleep apnea, I would highly recommend checking this out. The QR code here will go to a page on how to get connected to our support groups. This is not a support group in the traditional sense of we're going to get together and talk about our feelings. This is more of the psychoeducational, structured end of a support group, but the QR code will take you to a page where if you're interested in this, you could fill out a contact form to allow us to get in touch with you to get you more information and get you connected to Megan and Gabby. Okay, so final minutes here and final slides. Final strategy for empowerment, right? We want to find a balance between finding things that instill a sense and build a sense of hopefulness and have an outlet to share those difficult emotions like fear, like anger, like sadness, right? Emotions are like a spring, and the more we push down on them, the more power we give them, such that when we can't put any more pressure, we can't push them down anymore, they tend to come out in whatever way they want to, and often sideways, right? So hope is a very important thing to foster. And hope is just one nuance of the experience of being a human. And there is such a thing as toxic positivity. I just have to think positively. Maybe you've said that to yourself. Maybe you've had that very well-intentioned family member, friend, coworker, church or synagogue member, acquaintance say, well, you just got to think positive. I know lots, I want to just say, I know lots of people who thought positive and still got cancer. And I know a lot of anxious and depressed people who've never had cancer. If the way we thought was a direct correlation to whether or not we got cancer or kept cancer at bay, that is just not a direct causal link, right? Certainly allowing ourselves to take care of ourselves and find ways to cope with those difficult emotions can be helpful for our well-being. Don't get me wrong. to put pressure on ourselves to just feel one exclusive facet of what it is to be a human. That's like toxic positivity is like telling somebody who has to pee, no, you don't need to pee. Don't pee. You're not going to pee, right? That doesn't work, right? I mean, you can hold, if you're in the car and you can't stop yet and you're waiting for the rest area, okay, yeah, but nobody can not pee forever. And that is how challenging emotions are, right? Um, so, what do we want to do? How can we balance this, right? We want to acknowledge that there are going to be triggers, and we also want to figure out how can we cultivate hope. There are going to be times that you can anticipate or that you may not be able to anticipate that are going to cause intrusive thoughts, remembrances, feelings, about your cancer experience. We can predict some of these, going for follow-up visits, hitting anniversary dates, other milestone dates, birthdays. But then there's some things that we can't anticipate, right? Somebody gets diagnosed with an illness, maybe not cancer, but you've got to go back to the hospital where you were treated. Um, you find out somebody had a recurrence, maybe of the same type of cancer you had, maybe something different, right? I remember when Chadwick Boseman um, was after he passed away. There was a lot of conversation here about how triggering that was for people, right? People in the public eye, it can also have an impact on how we are experiencing things, even if maybe we weren't a huge fan of that person, right? It still brings that all to the forefront. Certainly, symptoms, you start experiencing things similar to what you did if you had symptoms before your diagnosis, if you've got stuff going on that you don't know what it's from. These are all things that can kind of blindside us. And a lot of times, we don't necessarily recognize the trigger. We recognize how we feel, and then we're like, what's wrong with me? So, if you're noticing you're kind of out of sorts, right? Like you're feeling more melancholic, you're starting to feel that cancer related anxiety creep in, and you can't figure out where it came from, it can be helpful to pause and say, what's going on, what has recently been in my environment. Oh god, I was in the car and it's October, and in between like every song they were talking about, October's breast cancer awareness month, right? I sat with a client like that, and she talked about getting to the work and she was just completely discombobulated and stressed and didn't know why, and she snapped at her coworker. And when we finally slowed down and started talking about it, it was October and it was just like all over, right? She's just getting inundated. So helpful to slow down, because sometimes when we understand the trigger, it makes the feeling we're having more understandable, and it puts us in a better position to be able to do something about that, or talk about what we're feeling with the people in our life and our support system. And then last slide, how do we cultivate hope? So psychological hope, right? When we're trying to think about the phenomena of hope, right? In psychological terms, it is our the gas in the tank we have, and our ability to know how to get where we want to go, right? Do we have goals, and do we know how to get there? And do we have the motivation to do that? And when I talk about goals, I don't mean, sometimes the goal is like, I want to be able to walk that 5K at the end of the summer, right? Sometimes there's a concrete goal, but oftentimes we have goals that are much broader than that, that are just, I call them toilet paper goals. They're the goals that we're constantly refreshing, right? I have never found a roll of toilet paper that I could buy that never ran out. I'm constantly going to buy more toilet paper, right? There's goals that we're constantly feeding, right? Being a good parent, having humor in our relationships, being a kind and compassionate adult child, feeding our spirituality, caring for the environment, right? These are all things that are kind of related to our values, the things that are important to us. And if we recognize what's important to us and why it's important to us, and can have clarity about the fact that we're doing something to live that, right? That instills a sense of hope. And that installation of hope widens the eggs in our basket that are helping us to feel hopeful and can overall help us feel hopeful in general, and help us weather some of the ups and downs that come with having had a cancer diagnosis. Um, so, right, we can't live on hope alone, but boy, does it might make life worth living. So I will end on an inspirational note and just encourage everybody, think about the things that got put on hold that are important to you, right? Think about if there's some energy to prioritize. Think about the ways that maybe you're already recommitting yourself to the things that are important to you, even if they don't take energy, if it's just a way of being with the people around you. Um, and recognize that when you give energy to that, that you're also giving energy to your overall well-being and helping yourself heal from a manageable crisis that certainly leaves an impact. So, on that note, I am going to stop sharing. I know somebody, I want to thank everybody for being here today. Um, I know that we're at time and some people may need to take off, but I am happy to stay here and answer questions, and also share QR codes again if people want.